So what's happening now is we are really moving away from primary prevention of HIV, meaning that while there has been great strides were made and we did actually change people's behavior significantly, it wasn't enough to keep up with the pace of transmission of the epidemic. And I believe that we constantly and continue to rely on wanting a medical solution for these types of problems, if you will, meaning that if we could just get the vaccine, if we could just get the pill that you could take so you don't have to change, help people use condoms all the time. I mean, it's true. It's impractical to ask people to do things that you were never sort of naturally born to do, if you will. So now the shift is really, after 23 years, we don't have a vaccine, we don't have a cure, but we have very effective medications. And that didn't happen until 1997 when antiretroviral therapies emerged. Really HIV has changed the course of basic science in many ways for many other diseases, but for HIV, it really meant stopping the assumed early death. And with that came more and more understanding of the virus, and still a smart virus that we've yet to be able to get to the cure. So now the strategy is going to shift and has shifted to, can we suffocate it, if you will? Can we have everyone who is infected get treated so that they are no longer infectious? And if we can do that, then we can probably reduce the epidemic to such a small degree that we could eradicate it. Not through destroying it, but simply through preventing it from being transmitted ever again. So that has been the real shift, which has meant that we are in some ways abandoning the more intensive behavior change interventions that I was a big part of for a period of time, to shifting to the person already infected and how do we ensure that they, first of all, know they're infected, and then as quickly as possible become virally suppressed so that they don't infect others. We couldn't do this at the time. I actually was part of a group that created the first prevention interventions for people with HIV. We had stayed away from that because people were stigmatized so much if you had HIV, that to create programs that essentially were saying, we're going to help you not infect somebody else, at a time when people were being criminalized for that, was a very delicate transition from doing primary prevention to do what they called secondary prevention, preventing people with the disease to transmit it. So now we are very much in that mode, and now we're really working towards recognizing that there's such a large number of people with HIV who both don't know it, and then once they do know it, do not have access or do not themselves choose to access medical care soon enough, or cannot access medications and need to, again, so they can become virally suppressed. And so that now is the target, how to get everybody who has HIV virally suppressed. And that's the new solution, and that's the new strategy to try to eradicate HIV. So research has now shifted. So my work went from those interventions, first with people HIV negative, then curriculums with people who were HIV positive, and most recently looking at linkage to care for people who know they have HIV but have chosen not to be involved in or aren't involved for one reason or another in getting consistent care, and trying to understand what those barriers are. And this is a disease that started in some ways as a disease, it was disguised as a disease of wealthy white gay men. And over time, we have now seen the concentration predominantly among blacks and still among gay men, but it's also Black women. And so it's, we sort of see the disparity emerge over time that was always there. We just didn't look at the epidemic that way. We were looking at total numbers. We weren't looking at proportionally. And so there was always a disparity, but we hadn't looked at it that way. So now it's really, the challenge is much bigger now because, in fact, the folks that are not getting care are, at least in the United States, more likely to be poor, disenfranchised, and actually quite disappointed with our healthcare system and in many ways avoiding it. And they will also die younger because of it. They're not getting treatment, but they also then have the potential of transmitting it. And so that's going to be the challenge.